reluctant to take this vaccine. And some of them are people that we know. And some of them are educated, and some of them are not as educated. But they are living in this city, and they are still very reluctant to take this vaccine. And we have to acknowledge, in many ways, the reasons why. There's a history there for many, but the reluctance is very, very real. I know almost every single day when I'm giving out the numbers of the people who are impacted by this virus, those who are contracting it, those who are dying from it, in almost all of those reports, there are people of color in communities that many of these elected officials represent, and they are definitely impacted by it. I had a conversation with one person in particular on yesterday, who happens to be someone who I know very dearly, who indicated to me that she was not eager to take this vaccine. And she asked me, Mayor, when are you getting it? And I told her, well, I am scheduled to get it this coming Monday, January the 4th. And she said, are you taking it? I said, yes, I'm taking it. I'm going to take it in both arms, but I'm going to take it. And then I told her that today, I'll be with a number of other elected officials, people that I know, who will be taking this vaccine today. And I will tell you in that conversation, it made a difference. And so what she said, well, when you take it, Mayor, then I'll be willing to take it. But I want to see you take it. And so I want to thank the Dean of the Texas House, Sophronia Thompson, the educator in the Texas House, Alma Allen, the head of the Legislative Black Caucus, Harold Dutton, one of the 2 African-American senators in the state of Texas, representing 50% of the Senator Boris Miles, someone who has been a masterful leader on health care, Garnett Coleman, and someone out of the Beaumont area who has been very supportive of transforming communities, Joe Deschatel. And then someone who has been a city council person, a state senator, and now a county commissioner, my friend Rodney Ellis, for stepping up to do it, and to do it in a very public way. And I'll close by saying this. It makes a difference. And it makes a difference when people see those who they have voted for and those who represent them stepping up to take something when there's still a lot of questions being asked. So this is a monumental moment. I think it will be a very impactful moment, and I look forward to being with other leaders, elected officials that represent our Houston-Harris County area for stepping up and doing the same. So thank you all so very much.
So thank you, Mayor Turner. So we are currently in the home district of our next speaker, Senator Boris Miles, and he has represented his district, which includes the Texas Medical Center, since 2016. He is a leader in ensuring the health and well-being of all Texans, as he serves as a member of the Senate Health and Human Services Committee. Prior to his Senate service, he served in the Texas House representing most of the south side of Texas, including our UTHealth Harris County Psychiatric Center campus. Please help me welcome Senator Miles.
Let me thank Dr. Love and also thank the leadership of the UT, which includes my good friend and former colleague, Dr. Zerwas. Thank you, Mayor, as well, for being here with us this morning. I want to make it plain and clear. The Harris County Black delegation, as you see us assembled here today, we stand alongside Dr. Kizma Makia Colbert, one of the African-American scientists who helped to develop this vaccine. We stand with her and encouraging everyone to get the vaccine when it becomes available to you. Medical experts have stated that we won't end this pandemic until 75% of us have been treated. although African Americans historically have their suspicions of medical treatment with their government, and they have the right to have that suspicion, but in this particular case, there are no statistics in this case that can justify us not getting the vaccine. Listen, as we've seen, COVID-19 has killed, and it will continue to kill unless we can get ahead of it. I serve as a ranking Democratic member of the State Health and Human Services Committee. On December 7th and 8th, we held a 2-day hearing on the COVID pandemic in Texas. The Commissioner's Department of State Health and Services, John Helstedt, and Associate Commissioner of Infectious Disease, Imelda Garcia, laid out the state's principles for distributing the vaccine. And I want to take a brief moment to explain what the state of Texas has committed to do. And legislators, it's going to be our job, since they laid it out, it's going to be our job to hold them to it in our communities. I was happy to see the ethical principles in their layout, maximum benefits, encompassing an obligation to protect and promote the public health and social economics while being in short of a long term. Equal concerns requiring every person to be considered and treated as having equal dignity, worth, and value. Mitigation of health inequities include the obligation to explicitly address to the higher burden of COVID-19 experienced by populations affected most heavily, given the exposure to health inequities. That's our communities. Procedural principles, fairness, requires engagement of the public, particularly those most affected by pandemic, in an impartial decision-making about even-handed applications and allocations criteria. Transparency includes the obligation to communicate with the public openly, clearly, accurately, and straightforward about the allocation framework as being developed and deployed and modified. And last, evidence-based. Express the requirement to base the allocations framework on the best available, consistently update scientific information. Dr. Zerwas, as you head that community, you had something to do with putting this together, so I thank you. I think you should get a round of applause because I thank you from the black community. But please understand, it is everyone's job that's assembled here today to make sure that this document that has been put out on 7th and 8th of December, that we hold you accountable to this. And we look forward to working with you on a grassroots level to making sure that all of our Texans, including African Americans, are tested. Thank you for allowing me this time.
Thank you, Senator Miles. So our next speaker is truly a Texas treasure. Representative Sophronia Thompson, who is affectionately known as Mrs. T, we really thank you for your vision for today's event. She has served in the Texas House since being elected in 1972 and has way too many accomplishments to list. But I will say she is the longest serving woman and African American in Texas history. So we thank you for your long-standing service. She currently serves as chair of the House Public Health Committee. Please help me welcome Chair Thompson.
Thank you so much. I want to give you 5 reasons why I'm taking this vaccine today. I'm taking it because, number 1, I'm an African American. Number 2, I'm female. Number 3, I'm 81. And number 4, I want to encourage my constituents who fall not only within my age group, but within my ethnicity to be encouraged to go and take this one. And fifthly, I'm taking it because the mayor agreed to give us all our vaccines. I know how important it is for this vaccine to be taken by everyone. You see, I lost a sister to COVID-19 this year. And I can't tell you how heartbreaking it is to not to be able to go and see a person who is in the hospital on a ventilator, who not to be there by their side, to not to have those last moments with them. And the only thing that you can do is to make the funeral arrangements and attend the funeral. COVID is serious. It is something that we must take seriously. And I want to encourage by taking this vaccine, along with my colleague, Dr. Alma Allen, because we were first graders together in elementary school and we agreed to take it at the same time today, so we can continue to show our solidarity on the fight for those persons who are reluctant to take this vaccine. If you think that I don't have reservations, you'll be wrong. I do. But I'm weighing the impact of the pandemic against the hopeful impact of this vaccine to help to eradicate and control this pandemic and to encourage all persons, not only my constituents, but all persons, to put aside as much as you possibly can the reluctancy and go and take the vaccine when your time comes. Thank you.
Thank you, Mrs. T. So our next speaker is Representative Harold Dutton, who was first elected to the Texas House of Representatives in 1984 and currently represents District 142 in Northeast Houston, Harris County, and currently chairs the House Committee on Juvenile Justice and Family Issues. Chairman Dutton.
Thank you. Let me start by saying, when someone asks me how old I am from now on, I think I'm going to say I'm 1B5. Is that what you said it was? I'm at least 1B5, so thank you, Dr. Zerwas, for that. Like the mayor, I was having a conversation about the merits of taking this vaccine, but that conversation was with myself. And I was, like the dean said, I was a little reluctant to take it. I was having conversations with my daughter, who's a doctor, and she said one thing to me. She said, "Dad, are you more afraid of the vaccine or the virus?" I said, well, she said, "Come on, Dad, you haven't heard of anybody expiring because of the vaccine." And I thought about that last night, and I said, well, thank you, Sinfonia. Thank you for putting this together, and thank you for getting me to where I had to make a decision about whether or not I was going to do this or not. And I think I've made the right decision, and I would encourage everybody in my district particularly those folks who, like me, or 1B5 or over, and if they have other problems, I would encourage them to also take this vaccine when it's available to them, because I think it makes a lot of difference. And I just, in looking at the history of pandemics, and particularly the 1918 Spanish flu pandemic, I was impressed with what happened afterwards and how they did it, and that even helped convince me also. So again, I think the best thing is for us to take this vaccine if we indeed are going to overcome this virus. I think, as I've said to folks before, we ought to let the science dictate to us. The science ought to tell us whether we can open or close. I was a little bit, John, I said to the governor, we ought to open the Capitol. But I think that has to be done in the right way, and that includes having everybody get the vaccine. And so again, thank you to everybody who had a part in this. Thank you for the people who invented the vaccine even. Thank you for making sure that the people who are African Americans have an opportunity to take this vaccine. We in our history have always questioned the relationship between government. And while I've said all along that people argue about whether or not you ought to have a big government or a little government, my argument always has been you always have a responsive government. And I think the right response to this pandemic is this vaccine. So thank you all very much.
Thank you, Chairman Dutton. So our next speaker is certainly a good friend to UTHealth. Representative Garnett Coleman has represented the 147th District since 1991 and has truly been a healthcare champion. Like our previous speakers, he has way too many accomplishments to list here. Representative Coleman is currently serving as the chairman of County Affairs Committee and as a member of the Public Health Committee. Please help me welcome Chairman Coleman.
Ms. T, thanks for doing this. It's very important. I talk to my mother periodically. She won't let me come by her house. She keeps thinking that I'm going to get infected, and I'm worried about her because she's 86 years old and is part of this population of elderly individuals who is concerned. I think this is the 12th time I've left my house since March. And the reason is I have diabetes, type 2 diabetes, and underlying health condition. And my cousin, who used to be senior advisor to Mayor Turner, Keith Wade, died of COVID-19. I've had a couple of friends who have died because of underlying health conditions. And it's extremely important that people who can and are indicated that there's a need to get this vaccine, that get it. Get this vaccine. Those individuals happen to be African Americans and are very much at risk. And I'm so glad that Dr. Zerwas, that your group and the group that is looking at who should get the vaccine sees that this is a highly at-risk population that needs the vaccine as soon as possible. And I am privileged to be a part of the group that gets the vaccine today, because I would like to leave my house for the 13th time. It goes without saying that those who won't get it today need to get it and need to see that the individuals here are getting this vaccine because we know we need it. We know we need it to maintain our health and our lives. A childhood friend died on Christmas Day of COVID. The deaths are not going away until we have an immunity that reaches a level of an advanced number of people vaccinated. But until then, we all still have to wear these. We all have to stay in and away from people who are in quarantine or who have come in contact with someone who has the virus. If we do have the virus, we need to stay in contact with our friends, so when somebody's bringing you a meal, they don't find you as a statistic to this virus. We all need to continue to wash our hands and use hand sanitizer and to remain 6 feet apart, and again, to use masks so that we don't inadvertently infect others or get infected. This is serious business. As chair of the County Affairs Committee, we've had jurisdiction over the emergency management circumstances with the counties in the state, as well as with the state having that jurisdiction and responsibility. And so we ask you to do these things. One, if you're eligible to take the vaccine now, and particularly if you have an underlying health condition or have immune compromise, please go take this vaccine, because the danger has not disappeared, and the only way to be sure that you are not vulnerable whether you're in a community of color, whether you're elderly, whether you're immunocompromised or have underlying health conditions like me, type 2 diabetes. You need this vaccine in order to keep from getting COVID and potentially losing your life. The other is, please maintain the vigilance that you have been maintaining, and if you haven't, start now so that you prevent yourself from becoming infected and becoming a statistic of this illness. Until then, stay inside if you can, work from home if you can, but if not, go get the vaccine, please, so that you can continue to take care of yourself and your family. Ms. T, again, UTHealth Science Center, Dr. Zerwas, Dr. Colasoro, the individuals here, Dr. Love, thank you for having this event. And I am, like others, I am apprehensive. I am concerned, but not so much so that I don't trust the science and that I haven't gotten stupid yesterday. So let's all be smart, take advantage of the circumstance, take advantage of the vaccine that's available to us now, and take advantage of the health in our circumstance of being able to get this vaccine to prevent from becoming infected and infecting others. Thank you very much for having me today, and I'm looking forward to taking this vaccine today to keep others safe and to keep myself safe.
Thank you, Representative Coleman, and thank you for your transparency about feeling a little bit apprehensive, because we know many of your constituents have those same feelings, but we want to continue to educate on the importance of the vaccine. So we do have the pleasure of having our next speaker, who is one of our neighbors from Beaumont, which I shared with him earlier. That is where my mother's family is from. And Representative Joe Deschatel has served in the House since 1999 and has held various leadership positions. He currently serves on the Calendars Committee, the Human Services Committee, and the State Affairs Committee. Please help me welcome Representative Deschatel.
Thank you very much, Dr. Love. It's a pleasure being here with my colleagues from Houston. I know some of them think that, Beaumont is a suburb, but we do have our own mayor, we have our own county commissioners, but I do appreciate Sinfroni inviting me. She called and said, Deschatel, how old are you? And I said, 69. She said, well, I think you need to come with us and get the vaccine. And I said, well, how will that look? I mean, just because we elect, she said, no, your constituents need to know that you think it's safe. And I said, well, that is an important message, because I know a lot of the constituents in my district have underlying conditions. A lot of them are elderly, is an older population, and that population grew up many years ago before we had the EPA and before we had the environmental issues close to a lot of petrochemical industry down there. So there's a lot of asthma, there's a lot of underlying health conditions in that older population. And so I said, well, I'd be happy to do it. And so I came over today, and I hope that message gets out, because I know there's some concerns, there's some distrust, there's some apprehension on the part of many of our constituents. And so I think hopefully seeing us take the vaccine will say, okay, it's okay, and then hopefully by the time it gets to them, we'll still be alive and kicking, and they say, yeah, it was okay, because that was 3 weeks ago he took it, or 2 months ago he took it, and he's still here, so I'm going to take it. So I appreciate Dr. Zerwas, Dr. Love, and all of our hosts, and this is going to mean a lot to a lot of people. Thank you very much.
Thank you. So our next speaker is Representative Alma Allen, whose entire professional career has been centered on education. And as you know, here at UTHealth, we value education. She served on the Texas State Board of Education for 10 years prior to being elected to the House in 2004 to represent District 131 in Southern Harris County. She was a teacher, principal, and administrator for HISD. Dr. Allen continues her education service as a member of the House Public Education Committee. Representative Allen.
Thank you, Dr. Love. And I want to say congratulations to you. You understand? I'm excited today. I've been waiting for this day a very long time. I, too, like Garnett, went in my house in February, and I haven't come out since, so I only come out to go to the doctor or whatever. But I've been avoiding getting in the streets for a very long time, and I'm ready to go back to life as normal. And so I'm encouraging those of you who are constituents of mine, friends of mine, family of mine, to go out and get the vaccine. I'm taking it today under some convictions that, like, some family members are like, why are you doing it? Because I'm ready to go back, and I'm encouraging everyone else. As an educator, I'm encouraging teachers, bus drivers, cafeteria workers, office staff, those of you who come in contact with our children every day, to also go out and get your vaccine. That's the next generation, and we want them to be safe and educated. And so I'm encouraging you to do that. You look back and see generations to come. I look at Rodney. Rodney was my third grade student. Did pretty good, didn't I? And so I take that seriously. Let me say thank you to Dr. Zerwas. Thank you to Sinfronia. Sinfronia and I, like she said, was in first grade together. Sinfronia didn't call and ask me how old I was. She said, you just come over here and take you come take this vaccine, and whatever Sinfronia does, says, I do it. And so let me say thank you again for that, and I'm glad to see my mayor today. Very glad to see him. Thank you very much.
Thank you, Representative Allen. So last but certainly not least, we have the honor of having Harris County Precinct 1 Commissioner Rodney Ellis join us. Commissioner Ellis served in the Texas Senate from 1990 to 2017 when he won his election to the Commissioner's Court. Please help me welcome Commissioner Ellis.
I know you all in a hurry to get these shots, so I will not give a keynote address. I do want to thank you, Mayor, and Ms. T, all of you all for organizing this to get us here. Now, when Ms. T called me, she told me to wear short pants. So when I read the deal, it said short sleeve shirts. So in case you all don't have short pants on, you do know this is a booster. This is not a shot. I do want to compliment Ms. T. It was important for us to be here in particular. That 40-year Tuskegee experiment, can you imagine someone kept a secret experimenting on African American men for 40 years? That was not that long ago. Mayor, you and I were going to college. Ms. T, you were going to the State House. Representative Allen, you were still dealing with bad children like the one you had in the third grade. It was not until 1979 that then President Clinton had a ceremony at the White House to apologize on behalf of the American people. And some of those black men were in attendance. They were still alive. The legacy of that experiment, unfortunately, Garnett, Harold, Deschatel, Boris, still lingers in communities of color. And not just African American communities, Hispanic communities as well. So, Ms. T, that's why it was important for us to come here and make the case, acknowledge our history and that sordid past, but to say we are better than that. And we want to encourage everybody, black, Hispanic, Asian American, whites, everybody to get it. But in particular, we acknowledge the fact black lives do matter. And we want people to get beyond that period in our history. So thank you for inviting me. I'm looking forward to the shot. Mayor, I rode my bike over here. Now, it said they're going to watch us for 15 minutes. But since we dragged on a little long, it might be raining. So somebody's going to put my bike on the back of a truck and get me back home. Thank you, Ms. T.
Thank you, Commissioner Ellis, and thank you to all of our speakers once again. I truly think that this will make a difference in educating our community on the importance of the vaccine and doing our part to really try and keep our community safe and healthy. So now our speakers are here and happy to answer any questions from the media.
Maybe Dr. Zerwas can talk about this on the fact that, I think a lot of people are looking at the state data and they say the state's had, has received over 600,000 doses of the vaccine, but as of this morning, we've only had about 120 some odd thousand distributed, and in Houston, we only distributed about 20% of the 124,000 that's in Harris County. And so there are a lot of people who want the vaccine, and they're calling UTHealth repeatedly, they're calling Memorial Hermann, and they're calling Methodist, and they're all told, no dice for you. What do you say to those people, and how can they get their vaccine?
Well, thank you for bringing that up. And like a lot of things during this pandemic, there's been a lot of technology challenges in terms of actually acknowledging how many inoculations we've given versus how many are actually showing up on MTRAC, which is the database that Department of State Health Services is using in order to keep track of this. The reality is a great number more inoculations have been given. We acknowledged that this morning in our expert vaccine allocation panel meeting that we had. It takes time to work through these things, just like it took time to work through it with testing and just about anything else that this pandemic has thrown upon us. But as was mentioned earlier, as Dr. Colasurdo mentioned it, patience is going to be an incredibly important thing during this. We all agreed easily that healthcare workers, in order to protect the integrity of the healthcare system, let's put them right at the front. And we've been very, very effective in getting them to the front for those who wanted to take it. It's not a mandate. And there are some people that just don't want to take it right now. And so we've gotten through well over half of those people, we feel like now. It's now time for us to focus on the so-called 1B population, which is 65 and over, or 16 and older with some kind of comorbid condition, some kind of other medical illness. And so, what we would say is that it's a very large number of people. A lot of this is going to be determined on the ground level. For instance, it's much more likely that somebody 75 and older is going to have a bad experience with COVID than it is somebody 65 and older without necessarily any other disease. And so we're going to be trying to work through this period of time where we have a very large 1B population. We don't want to discourage anybody, but the bottom line is our supply is going to be far, far below what the demand is, what the need is out there. We're hopeful that the supplies can continue to increase from our manufacturers. Hopefully there'll be a couple more vaccines come into the market in the next couple of months. So that will be very helpful to improving the supply chain.
So how many of the 600 some odd thousand doses the state has, what's your estimate of how much has been distributed?
We would guess probably around 300, 400,000. It's actually, we're going into week 4. We're going to hit over 1 million doses that are going to be allocated to the state of Texas after that time. That's what we anticipated to some degree. We thought it actually might be a little bit more than that. But we're getting it out as fast as we can, getting into the hands of the various people who have been identified as providers of the vaccine. And we're just going to continue to push that with the expectation that as soon as they get their hands on it, that starts flying off the shelf to those that are in the categories that are approved at this time.
So for providers, because people have been calling their providers for their HEB or whomever, and they say on the phone, like Kelsey Siegel, UTHealth, and a lot of people have said to us on the record and their patients that they're still doing 1A. Are you saying right now that they should actively move to 1B? They should stop telling the people who call them that they're still doing 1A? That's incorrect.
Yeah, just as of yesterday, officially, Commissioner Hellerstadt from the Department of State Health Services sent out a memo basically saying, continue your 1As, which are largely your healthcare worker provider pool and stuff, but also do the 1B population also. So that's actually only less than 24 hours old that was officially made as a proclamation. But certainly, where we have seen places that have actually gone through their allotment or their 1A population, but still had vaccine left over, so to speak, the only wasted vaccine is a vaccine that sits on the shelf. Every vaccine that goes into an arm contributes to that so-called herd immunity that we're trying to achieve. And so we're trying to identify those populations that will get the greatest impact from it, which is obviously the ones that we've identified in the 1B. Try to get that in there, but most importantly, get that into arms so that we can continue to improve our level of immune status.
Hey, Maya, can we, let me just make sure there's nobody else, because we will be available after, and we have a short period of time here.
I'd love to ask some
We have
questions.
vaccines to get to, yeah, we have vaccines to get to, so if there are other media, if you have questions.
Yeah, Dr. Zuris, so yeah, I mean, but the numbers that the state is putting out, you know, from, and there was a letter from Dr. Heller's staff yesterday, basically saying, you know, he said in the letter, we got to move faster. This is not moving along fast enough. So do you disagree with him, or do you feel right now, in Harris County, there were something like 110,000 doses provided to Harris County, and only 23,000 have gone to anybody. The rest are sitting in a shelf someplace. Do you find it acceptable what's happening right now, or do the healthcare providers need to move faster to get these into the arms of the frontline people?
We definitely want to accelerate inoculations to the extent that it's safe and a viable way of doing it. I'm aware that here at UTHealth, they'll be doing over 1,000 a day. UTHealth San Antonio is doing well over 1,000 a day. Some of the healthcare facilities right here in Houston are even exceeding that number. Again, the numbers that you're seeing that are officially in the dashboard aren't quite up to speed with what the actual numbers that are being given. And again, as I mentioned earlier, there's technology issues that have prevented actually getting that number onto MTRAC. We're working on getting a much more real-time estimate of what the vaccine is. Maybe it doesn't have all the demographic data that we want, which is what MTRAC has in it, but did a vaccine get put in an arm? That's what I want to know. And if it did, then it's one great step towards us getting closer to herd immunity. And we'll continue to work on that. But you know, just like testing was a challenge, as you may remember, we thought hitting 25 to 30,000 tests a day back in the April timeframe was just almost an impossible task. We're doing 120,000 tests a day right now in this state, and we aren't having any glitches at all in that. But that took weeks, months, in fact, to get to a point where we could actually do that. It's not going to take months to get there. Again, inoculations and vaccinations is something that people in this area do every day and have done for a long time. Doing it at this magnitude and at this scale, that's different. But I will tell you, I couldn't be more pleased with what I've seen around the state and people really taking this serious. And as soon as they get that vaccine, within hours, less than hours, they are actually getting that vaccine into arms.
One thing, what would you say right now, at this point, how many medical personnel within the state of Texas have actually gotten the vaccine, as far as you know?
We would estimate probably about 60% of the people based on what we've given out and what we understand to be the 1A population that's inoculated. And so understand that as we transition into these different populations of people, we're not saying 98, 100% of 1A is done, because that could take a little more lingering time. What we're saying is we need to move into the next population so that it's kind of a stair-step sort of thing as we move towards getting more and more people into the queue, basically.
And last thing, do you have a plan to move this along faster, to get people vaccinated? Frontline workers and the people in nursing homes who are supposed to be getting the vaccine right now, do you have a plan to move it along quicker than it has been so far?
Right, so it's a good question, and so we're continuing to enhance the number of providers out there that are getting vaccine. Week one, we started with 110 providers that could receive vaccine. It was Pfizer only at that time. The next week, we were over 1,000. We have over 7,000 providers out there, if you will. That includes pharmacies and others that are ready and have, basically applied on the portal to receive vaccine. Obviously, because the vaccine is limited in supply, we're going through a very conscientious effort to try to identify where can we get the vaccine in the hands of those providers that are going to hit, the most vulnerable populations. And so our pharmacies have partnered with us in a very big way to say we're going to step up and address the nursing home population. There's a national program that's in place that the pharmacies have taken up, and they are actually on target to actually start that and get that going. But our pharmacies have, outside that federal program, have also said, we'll take on this nursing home population. We'll get this vaccine into their arms.
Does anybody have any
Yeah, I do. I have a comment. Thank you. And we serve together a lot. I try to do a lot of things, particularly getting people health coverage. I think what's really important here is it doesn't matter how many doses of vaccine that we have if people don't want to go get it. And that's what we're here to do today, is to encourage people to get the vaccine. So can we go ahead about the business of encouraging people to get the vaccine so that when it is available and when the MTRAC is taking notice of that vaccine that's been given, that people want to go out and get it? I'm answering a question. I understand, but the process here today is to encourage people to get the vaccine. You are right. It should get out faster. We want our constituents to get it and get it faster. But if you were in the barbershop with me a Friday ago, there was too much apprehension. So I think it's very important that we go about the business of getting people, encouraging people to knock down the doors to get this vaccine from the providers who are there, and to push us and push the governor and the health director, the commissioner of health, to get this vaccine out there. And that's all I'm saying, because I think it's very important that we do that. And that was one of the intentions of this press conference, is to encourage people to go out and do just that. And I'm not. Yes. So if we.
Unless they decide that they want me to.
No, I know the media has some questions for the mayor. I just didn't know if you want to answer it now or.
Now, I just want to keep an eye on what we're here for, which is the fact that we're trying to reach an audience that historically has mistrust, and we're encouraging people to get it.
And you're
So I don't want to get off, but I want to get off my track.
I'll stay around.
You'll stay around.
Vaccine,
Okay.
Because then they leave and then they come.
This time.
Joe, how are we going to get the weight back off, man? We got to get back on that.
We can't get African Americans to come and take the vaccine when the ones who even wanted it can't get it.
Well, it's going to take time, Mike. That's not going to happen overnight.
Well, I know, but that's why we ask tough questions, and I'm not going to apologize for asking the tough questions for the man who has a draft going to the governor for the 600,000 doses.
That's fine. That's not what we're doing.
But it's my job.
We need to make sure we have safe. The check-in is actually going to be after first.
Okay. I'll get a chance to check it.
Unless they've already reached out. Maybe away until Yeah, we're gonna wait out here. Does they have any in yet?
Yes. They have all that. I'm with the group of